Good afternoon, ladies and gentlemen. I'm Ben Zeller, Victoria County Judge, and I want to thank you all for being here again today to hear the latest discussions related to COVID-19. As of this moment, we have no confirmed cases of COVID-19 anywhere in Victoria County. Due to the various rumors that always go around in situations like this, one of the first things I want to stress today is the importance of relying on accurate information. The source for local, up-to-date, accurate information will be through the website of the Victoria Office of Emergency Management, which is victoriatxoem.org, victoriatxoem.org. That web address will route you to the most current information we have from our health department, including all the Facebook posts that they've put out with pertinent information regarding this situation. In an additional step to ensure that our residents have the most accurate information, we're also setting up a Victoria COVID-19 hotline for folks in our Victoria community to call the people who would prefer to talk to a live person with questions they might have. The phone number for that Victoria COVID-19 hotline is 361-580-5796, 361-580-5796. The initial hours of operation will be Monday through Friday from 8 to noon, and then again from 1 to 5. If we see the demand for that hotline increasing, we're prepared to extend the hours that phone line is manned. So 361-580-5796. The second thing I want to talk about before I turn the mic over this morning is the empty shelves at our grocery stores that you've all seen. Those empty shelves are not being caused by the coronavirus. COVID-19 does not infect the food supply. It does not reduce the availability of clean water, and it does not curtail the manufacture of toilet paper. The reason you've seen those things missing from the shelves is due to panic purchasing, which might be a natural response that folks have, but really what it does is hurt the folks who need those things the most. And also, very importantly, it's unnecessary. During Hurricane Harvey, one of the incredible things we saw here in this Emergency Operations Center and throughout our community was our residents coming together and helping each other. You saw the neighborly conduct of friends helping friends, neighbors helping neighbors, and that was a beautiful thing to see during Hurricane Harvey, when people go to the store and buy 20 times more than what they need. That's kind of the opposite end of the spectrum in terms of looking out for your neighbors. Anecdotally, we hear stories about folks going into the stores needing something for their children. Even baby formula, they say, is in short supply at some of the places. So that's not necessary. It hurts those who need it most, and it's unnecessary. We've been in contact with our large local grocery stores. I know some have put out statements detailing the fact that there's no anticipated disruption in the supply chain. The local folks we've talked to don't see any issue with those shelves being restocked throughout the week like we're used to. So this stockpiling is really unnecessary. One of the folks behind me will address some things momentarily that you can actually do that would actually help, but the panic purchasing is counterproductive and completely unnecessary based upon everything we've seen thus far. I'm going to turn the microphone over now to Mayor Rowley Mccoy for a few remarks. Mayor?
Thank you, Judge. Again, I'm Rowley Mccoy, the mayor of Victoria. First of all, I would like to simply reiterate what I said yesterday, that our local city, county, emergency management health officials have been working tirelessly for weeks to address the COVID-19 situation in our community and the anticipation of it. It's important to note that these professionals and healthcare experts will continue to be the group successfully guiding us through this crisis. We need to continue intently listening to and working from this collaborative group, from whom accurate and consistent information will flow to media and Victoria residents. Now let me address some questions regarding our policies on interruptions of services and cancellations of public gatherings. At this time, business will remain as usual. The county and city will not change events or services available to the general public. Things are rapidly changing, so should circumstances warrant a change to that direction, we will immediately inform you. We are also following guidance from the Center for Disease Control, which at this time does not recommend any city or county-wide cancellations of mass gatherings. That decision will be left to the organizations hosting any large events or gatherings. We have plans in place should there be a confirmed case in Victoria that would be considered a community spread, meaning confirmed cases was a confirmed case that was contracted within the community and not from travels. Again, if circumstances change, we will immediately notify the public of any county, city event cancellations or recommendations for mass gatherings to the public. So what I can advise you most of all is take care of yourselves and take care of each other. And I'll next turn it over to David Gonzalez, our Director of Victoria County Health.
Good afternoon. Again, my name is David Gonzalez. I'm the Director of the Victoria County Public Health Department. Again, just as the mayor had noted, we do have 0 confirmed cases in Victoria County at this time. I did want to address some questions regarding lab testing capability. So right now we do have the availability to collect lab specimens here in Victoria. We do send those samples off, however. So technically, there were some questions regarding our ability to run tests in Victoria. And we don't do that, but we can collect and send off to labs, part of the laboratory response network. And now there's a lot of private labs that are coming on board as well to help us out with that capacity. As of now, right, if patients are collected or tested, they're going to be monitored and isolated at that time until results come back. We're expecting usually a delay about 3 to 4 days for those samples to come back at this time. That could vary, but that's just generally what we're seeing on average for those to come back across the state. Right now, they have to meet criteria. They've got to meet criteria. They've got to go through tests with their local healthcare provider, and then once they move past those testing for flu and some other respiratory panels, then they would qualify based on our recommendations for a COVID-19 test. If you feel like you may have been exposed to COVID-19, you're feeling ill, make sure you get with your healthcare provider. Call ahead though, if you're going in, to let them know your symptoms and if you've had any travel history at that point. Again, like the mayor stated, right now we're not recommending any cancellations of mass gatherings at this time. We're going back off CDC guidance on that. But if anything changes, we'll definitely let the public know for sure. There's a question regarding how we're addressing homeless population and some of those hard to reach and more vulnerable populations and how we're going to help them out. Right now, we're going to rely on both the internal operations with the OC and then get with those other nonprofit agencies that normally are the resources for those folks and coordinate that response with them. Some of the things the public now that can do now, really to prepare, if you will, one, make sure you take care of yourself. Those basic hygiene recommendations that we've been communicating here for a while now. If you have, if as we move along to this, if there's ever a case in your home, if a family member gets sick, have a room available for them to stay and essentially isolate in their own home to take care of themselves. Make sure you have, their medications, any prescription filled that are available to them. If there's family members, obviously, that may come down with this, make sure you have some sort of way to contact them on a regular basis and keep in touch and check on their well-being. And with that, I'll pass it back off to Judge Zeller for closing remarks.
Thank you, David. Want to reiterate that hotline, the COVID-19 hotline, 361-580-5796. That's for members of the public to call with questions. For members of the media needing accurate information, we've distributed a packet to everybody. Going forward, there will be specific people serving as public information officers. For the media, we've activated a joint information center for COVID-19 and established certain individuals to contact with all media inquiries. The folks serving in that role would be Caitlin Weinheimer, my chief of staff, and then Ashley Strevel with the City of Victoria. And their phone numbers has been given to all members of the media. Also in those packets are answers to a lot of the frequently asked questions that we've gotten, that we've heard, that we've seen online. There may be additional questions this morning, and we'll go ahead and open up the floor to any additional questions you folks may have.
Can we start, you mentioned the information hotline, just to confirm, that's just for information if a resident without a doctor has symptoms, they should call the public health department?
That phone number is not specific. That's for anything related to COVID-19. It could be a question like that. I don't have insurance. Who should I contact? But also other things such as public closures, visitation at the jail, basically anything that any member of the media would reach out to a city or county office for, whether that's the sheriff's office, juvenile detention, the city, public works related. It's an all-encompassing hotline where the people manning that would find the answer.
Okay, and I'm sorry, I'm talking about the Victoria COVID-19 hotline, not for media.
Correct,
Okay,
correct.
Okay, got it.
Correct.
Okay, great. Just to check quickly, CPL Laboratories in Victoria said that they recently got the capacity to start testing here. Can you just explain how and if that process is any different than the public labs?
David, have you gotten recent information on that?
Sure, I just found that actually a few minutes ago when I spoke with Brittany. I'm not sure as far as the process though, and I'm not sure exactly where CPNL, where that particular lab sends their samples off to. Basically, the message is the more private labs that come on board, the better, because it's going to speed that testing process up quite a bit. So it's a good thing. It's a good thing, but I can't really speak to specifics on how that actually works on their end.
Sure. And just to confirm, kind of yesterday, what were we talking about? Limiting visitations at the local jail and at the juvenile facility. We've also heard that we're, I guess, not taking transfers from other counties or from other entities. Is that accurate?
I know that was a discussion with the sheriff's office and the police department. I don't have the most recent information of how they've structured that. I can get back with you on that.
Okay, sounds good.
Unless, Jesus, do you have any?
No, sir.
Okay.
Okay. And then just in terms of kind of misinformation spreading around, is there anything that folks should watch out for? Maybe screenshots or images that look like they're altered? Anything that you can tell them that might be a signal that the information isn't correct?
Certainly those two things, but big announcements, information that has not been put out by the local health department or emergency operations office. Dr. McNeil yesterday addressed the rumor about bodies in the basement of Citizens Medical Center. Any big announcements, any announcements with new information is going to come from the folks you see up here, from people in our group. It's going to be put out through the website that I mentioned, victoriatxoem.org, on the county health department's Facebook page. That's where that information is going to come from. So if you're hearing big news that's not coming from that source, I would be suspicious of that. We do meet daily. to address new information related to this, and it's been a big priority of ours, a big goal of ours, to get that information out to the public as quickly as possible. So, in general, I would be leery of any information that's not coming directly from the sources that we mentioned.
So does this mean that you won't be holding these open meetings every day at 3?
No, we
You
plan
will
to
continue to do
continue
that.
doing that, in addition to the hotline, in addition to the information that we push out online and on social media. Correct. Yes.
I know that you said that the city is not recommending or demanding that large gatherings be canceled. For kind of regular day-to-day life, should I go to church? Should I work from home? Should I go to the movies or the gym? I mean, what do you say to the average citizen or the citizen who might be more at risk for contracting the infection?
Sure. All the guidance we've seen, the medical expertise we've seen indicates there's no reason for us to suggest that folks not go about their normal routines, maybe aside from more frequent hand washing, the normal hygiene. But I mean, as far as me personally, my family is really not altering our normal plans. I would be at church tomorrow morning if I wasn't going to be at a meeting here. So we're going to go about our normal routine, our normal plans. The people that have inquired about upcoming events and activities with large groups, the message we've given to them, that I've given to them, is we see no reason at this point to discourage them from doing that. If as soon as that changes and we have, for example, maybe a local case of COVID-19, that could change. But at this point, there's no reason we have to discourage those events. Did I phrase that correctly, David? I don't want to, I know you're on the front lines on this too. That's everything we've seen as of.
Judge, if I might add.
Certainly.
The one thing that we're probably advocating more than anything is just personal responsibility. We're trying to provide the most accurate information to the public that's available. We tell you about personal hygiene, distance and stuff. So really, it's people's personal responsibility and the responsibility of the people who are in charge of these groups to use that information with their own knowledge and knowledge of their group to know what to do. And that's what we're recommending for people to do until we get, I've used the word guidance very carefully, not direction. It's guidance from the CDC. So we're asking everybody to use your own common sense, take this information that we're providing you and use it within your own your own families and your own groups to make these decisions. And one thing I would like to say on a personal level, especially to the media, I've always made myself publicly available to the media. And if you call me about COVID-19, I'm going to direct you to the sources that we've identified. But if you want to call me about any other city business, it's business as usual. Do so. If you send me a text or something, make sure you say that I want to speak to you about this so that I will get back to you as quickly as possible. So that is part of business as usual also. Thank you.
Yeah. Thanks, Mayor. And to follow up on that real briefly, Mayor McCoy and I both have the ability, if we deemed it appropriate, to enact a local disaster declaration where we would have legally the ability to prevent large gatherings of whatever number in whatever areas. So we've had that ability, we have that ability, but we don't see the justification to enact that. I mean, that could happen at some point, but we see no indication that that's needed. And to follow up with what the mayor said, it is personal responsibility, but then we also stand available to give the guidance that we can and to provide the most recent information that we have available. Anything else?
Some folks have a lot of questions about travel, whether they should be traveling to large cities in Texas and whether they should be traveling out of state.
Okay, that's a David question.
Thanks, George. Right now, I could just recommend going to the CDC website and looking at those those areas, obviously, there's been restricted travel globally to those areas of high community transmission. And now, there's certain parts of the U.S. and Washington State, California, and New York, I believe, certain parts of those areas or those states that have high community transmission. So definitely be cognizant of where they're going there. Do some research, look online, look on the CDC website to see where those areas are. If there's an isolated travel case in an area, then the community transmission is not at that time. It's not evident. So we wouldn't really recommend avoiding that area for any reason. But just monitor your health. When you get back, be smart when you come back. If you find out later you may have gone to an area with high community transmission, monitor your health for a few days, multiple days. When you get back, take your temperature, make sure you're not sick. And if you are sick, stay home. Don't take that, that illness, whatever it is, COVID-19, flu, any other respiratory illness, to work or, to school at that point. So it's just widespread, recommendations as far as, stay home if you're sick. And I hate to reiterate that over and over again, but wash your hands, avoid sick people in the public as well. That's just the best advice right now to give.
And David, could you also just address both, camps people who think that the danger of this virus is overblown, and also people who might not think it's very serious at all, kind of speak to both groups if you can?
Yeah, and it's one of those things, and we have this discussion every day on why are we at the point we're at, and there's a lot of reasons. We're taking it very serious. But on the same token, we're not panicking. We understand the global health impact that it's had, and locally also, or in the state and the U.S. We're taking it very seriously. We're monitoring it. We're taking those necessary actions. Probably, I don't want to speculate into either end of the spectrum, but it's a respiratory illness that's similar to flu. And we take that on public health side very seriously. It didn't get the media attention that this one is getting, but definitely it's something we take seriously as well. There's obviously it's a new illness, so that's going to, there's no vaccine available, so that's going to contribute to, the heightened panic among some folks. So we're aware of that.
Is something that we've heard from the president, I guess today and yesterday, is talk about social distancing. Can you explain what that is, and if that's something that you think folks should be engaging in? Sure.
I can't speak directly. I don't recall the exact statement that he had made. But as far as social distancing, that kind of goes into, if you're sick, stay home. If you're maybe immunocompromised, if you're in areas where there may be sick people there. When you're in public, maybe increase your distance a little bit because again, I think we discussed this yesterday as far as how this spread. It's a respiratory droplet spread. So, usually if you're within or greater than 6 feet from those individuals, it's difficult to contract the illness. So that general guidance, is definitely recommended. Again, we're not restricting any mass gatherings like the judge and mayor said, but just some general social distancing guidance. It wouldn't hurt, especially if you're high risk or if you're sick.
And then can you just briefly talk about folks who might be extremely worried about the positive patient who traveled in Yoakum and Shiner, and explain, are they at risk if they walk into those same restaurants as that gentleman did?
Yeah, and I'm not sure exactly the details on the the locations of the restaurants or anything. But again, you start getting into kind of the viral biology of how long that survives, and there's some differing, research out there right now as far as how long a virus can survive. But as long as it's cleaned, again, it's only spread via respiratory droplets and not in the air and doesn't hold in the air. So that wouldn't really be any danger of it, staying in the air in that restaurant as long as the surfaces are clean on a regular basis wherever the gentleman was at, if he was symptomatic at the time he visited those restaurants. So there's a lot of factors that play into that. But again, if those folks were at risk on the epidemiological side, on the investigative side, they're going to reach out to those contacts that would be at high risk. And the folks that are heading up that investigation is the Department of State Health Services Region 8. So they'd reach out to those folks that they would have thought would have been at high risk for contracting that.
And we got a notice on our way over here that we're at a critically low blood shortage. Is it safe to give blood right now?
I cannot address that. I was not aware of that.
Okay.
So, yeah.
Okay.
That's all you've got? Anything else?
All right,
Yes,
so I'm gonna
ma'am.
ask the what if.
Oh, my.
I'm just saying, the what if. What if you do find that in the next 24, 48, 72, et cetera, hours, that we do have a confirmed case in Victoria County? How does that change for all of us?
That's been a question we've been talking about regularly. What would be our trigger points to take the next step as far as actions that we're able to take? One of those trigger points would be a local case, local transmission. And that's something that we will be talking about again tomorrow morning. There's a lot of entities involved in that decision. In terms of the school district, I mean, they'll look to these folks and our health authority for guidance, but that would be largely a call of the superintendent. But we're working together to all be on the same page as far as what our steps would be when and if that happens. So that would really be my answer at this point. Some of that is still to be determined depending on the circumstances. But that's something we to talk about every time we meet, which has been daily. Recently, we'll be back here again tomorrow morning to assess any new information that's out there. And any decisions made, we'll certainly communicate to you guys.
Thank you.
I can address a few minor, yeah.
Sure.
On the specifics as far as, a case here, one, we're gonna look at if it's travel related or community transmission, by our epidemiologist. She's gonna conduct an investigation, look at those close contacts to see, who that individual may have been around and see if there's a risk for transmission there. So those are the first steps. And then we look and then we weigh, okay, if this is a travel related case and they're isolated, had no contacts, and there's really no risk scientifically of any transmission there. But if there are risks, then that's what the judge was discussing. We look at those next steps, and it depends what the reach was, where they visited, who they're around, if they're symptomatic or asymptomatic, if they're, I guess, likely being transmissible at that time. So there's a lot of factors that go into that.
Thank you.
Sure, sorry.
And someone will be back here tomorrow at 3 o'clock to give the most recent information then. So we'll welcome y'all back again tomorrow and give any further updates at that time. So thank you all.